Part of the Level 1 certificate in Introduction to Health, Social Care and Children and Young People's Settings, run by Plato Training, and this is Unit 6, Introductory Awareness of Health and Safety in Health, Social Care and Children and Young People's Settings. The aims and objectives of this session are: by the end of the session, you will know the main responsibilities of workers and employers for health and safety in health, social care and children and young people's settings, and you will have an understanding of the importance of assessing risk in relation to health and safety. As always, you need to look out for the green box, which tells you which question the slide relates to, and that will support you within your answers. And remember that the PowerPoint presentation here to guide with pointers, and doing your own research and sharing your own ideas demonstrates a much stronger understanding of the content of the session. So we're going to start the session by looking at key areas of health and safety, and you will see this slide relates to question number 1. And we have a list here of key areas. I'm just going to talk you through the list, and then I want you to think for a few minutes before you move to the next slide what you think each of these key areas may involve. So we've got fire safety, we've got moving and handling, first aid, security, storage and disposal of hazardous substances, storage and administration of medication, and infection prevention and control. So for a few minutes, think about those, and just think, what actually might be involved, or what does it mean? So you will see fire safety. So that's about having the correct firefighting equipment, keeping fire escape routes clearly marked and making sure that they're not obstructed at all times. If somebody needs to escape out of the fire exit, it needs to be free from anything in front of it, so that, in an emergency, people are able to get out. Moving and handling. So this involves lifting equipment safely. It could be you're lifting a person, a child, an adult. So you need to make sure you do that in a safe manner, using the equipment for lifting. So if you've got equipment available, this comes under the moving and handling, making sure you use the equipment. And also we'll look a little bit further on within this session, but making sure you're trained to use the equipment correctly as well. First aid, so ensuring you have a first aid certificate, a relevant up-to-date first aid certificate, which obviously involves doing first aid training courses to get the certificate. Security, which includes data protection, which is also GDPR, risk assessment, and that's both indoors and outdoors. And again, we'll look at these further on throughout the session for you to have some more understanding about those. Locked doors, locked gates, these all come under the risk assessment, making sure the area is as safe as it possibly can be. Storage and disposal of hazardous substances, so this includes cleaning equipment, so like all your cleaning, your sprays that you clean equipment with, bodily fluids and nappies. Storage administration of medication, so ensuring you have permission to actually to keep hold and provide the medication. It would need to be in a locked cupboard. You would need a witness to say that you've given medication, signed records also to say you've given it, and also the medication usually needs to be prescribed if you're going to be administering medication. And finally, infection prevention and control, which includes hand washing, exclusion periods. So if somebody has an infection or a contagious infection, for example, say chickenpox, exclusion periods need to be in place. You need to record and report any notifiable diseases. So this brings us to question number 1, and it's asking you to outline 4 So 4 key areas of health and safety related to a work setting. Remember to use a sentence for each example. And for example, think about what you will need to use to safely lift or move an object. So think about the slides that we looked at before. So for example, with that one, we talked about having the appropriate equipment if you are to lift safely. So think about the last 2 slides and also think about, doing some research of your own, but you need to outline 4 key areas of health and safety related to a work setting. So this slide relates to question number 2, and you will see it's a piece of legislation, and it is by the Health and Safety Executive, and it's the Health and Safety Law and what you need to know. Now, you might not be able to see this very clearly on this slide, on this video. So what I would suggest is maybe do some research, do a Google and find this piece of legislation to help you to read it a little bit clearer. But what it's saying, you'll see this up in most employment buildings. As I say, it is law, so it needs to be on the wall. It could be on the entrance when you walk into a building. I've seen them in staff rooms, and it's telling you what employers must do for you, what you must do, and also if there's a problem. There's a website there. You'll see the www.gov.uk website there, HSC.gov.uk website. And again, you have a look on that website to see this a little bit clearer and have a read of it. And that obviously will help you with question number 2. So here on this slide, we have some employers' responsibilities for health and safety. So employers must have a written procedure which contains rules about how to work safely. Employers must check the rules regularly to make sure that they support a safe working environment. And employers must provide equipment and training needed to keep everyone safe. So like I said earlier on when we were talking about lifting and using a piece of equipment to lift an individual or a piece of equipment, employers must provide training and that equipment to ensure that you do that in a safe manner. They need to keep up to date with their written procedures because things change on a regular basis. So it's important that the employer is responsible for making sure those procedures are kept up to date and making sure they do that on a regular basis. So question number 2 is asking you to outline 3 employers' responsibilities for health and safety. Ensure you use sentences for each of your examples and also think about what your employer should be providing you regarding to the answers in question number 1. So what should they give you so you know how to lift, like I said before, how to lift and move objects correctly. So as I said before, you have a look on the government website also, looking at the health and safety regulations to help you within to support the answer for question number 2. So we're now going to look at this slide which relates to question number 3. And this is looking at the workers' responsibilities. So the employees, they're the workers. We've looked at the employers' responsibilities on the last question and the last slides. We're now going to look at the employees. So we said previously that the employers have a responsibility for putting procedures in place for safe working practice, and it's up to the employees to follow those procedures to make sure they keep themselves safe and others safe. And this employees must always use protective equipment available in the work setting. So this could be wearing gloves and aprons, so your PPE, your personal protective equipment, and like we said before, using the lifting equipment. If you were lifting somebody, that's there to protect. So you make sure you need to use it. It's there, and you need to use it and know how to use it also. And also, employees must tell someone if they feel that another worker is not following the the precautions, and they may be putting somebody else as health and safety at risk. So if they, if you saw somebody who wasn't using a piece of lifting equipment to lift a service user, so they may an adult, then obviously they're putting themselves at risk and the service user at risk by not following the procedures in place to lift that person. So question number 3 is asking you to outline 2 employees' responsibilities for health and safety. So ensure you use sentences for each example, and you'll see there, like the last one before, last question, have a look back at question 1 and 2 and just have a look, what if your employer has a responsibility providing you with something, what do you need to do to ensure the workplace is safe? So we're now going to look at this slide, which relates to question number 4, and we're going to look at health and safety training. Now, we mentioned a little bit about first aid training earlier on at the start of the session, but it's really important. You will get first aid training when you're working in the care environment. Now, it varies from how many first aiders you will need in a setting. However, in childcare, it's called paediatric first aid, and usually they have every member of staff will need to be paediatric first aid trained in a childcare environment. Now, once you start within your within a health and social care setting, you will be sent on a first aid training course. You will get a certificate, and they usually more often than not, they last for 3 years, and then they need to be updated. And again, it's up to your employer to keep that to make sure that you're up to date with your training, and also yourself. So if you feel like your certificate is coming to the end of its of the period, then obviously you need to make it clear to your manager, to the employer, that it needs updating. Food handling, so within the care environment you'll be handling food with adults and children, and again that will be some training course that you will most probably attend to get a food handling certificate. Fire safety, really important that you know about fire safety, and some of these training sessions will be internal training sessions, so it may be on your induction when you start at your new setting, where you will talk through some of these things. So fire safety will be something that you need to know about, what the procedures are in place for if you spot a fire, or and you raise the alarm, or if you hear the fire alarm, and knowing what the fire alarm is, because sometimes it's a bell, it can be a whistle, it depends on the individual setting. So it's important that you know that and what your responsibility is in to get yourself and anybody else out of the building safely. Hand washing, again, hand washing is a really big thing currently with COVID-19. As it was before, it's important that you do, you have to keep your hands washed, dried, clean, and knowing how to do that correctly. Moving and handling, we've talked quite a bit about that over the last few slides, but that's about lifting equipment, children, adults, making sure you know how to do that in a safe manner to protect yourself. The storage and administration of medication, again, you need to know what the procedures are for that within your settings. Most of these procedures, as I said before, they're very similar, but they may just be different ways that each setting might do it. Disposal of bodily fluids, so that could be, with children it could be nappies, with older adults or young adults, it can be, the bodily fluids, how you dispose of that. Use of health and safety equipment, so knowing how to use that as well. All these things are a part of the health and safety training that you will receive within the health and social care settings. So this brings you to question number 4, and you need to give 4 examples of health and safety training required in the work setting. So think about the last slide and what we've talked about, but also you can give your own ideas, do your own research. You need to give 4 examples, and you need to write a little bit about each one that you give. and why you might need training in that particular area. So we're going to now look through the next few slides looking at hazards and risks. So the first slide here relates to question number 5, and it's just a slide to talk about hazards versus risk. So a hazard is anything that may cause harm, such as chemicals, electricity, working from ladders, an open drawer, etc. The risk is the damage the hazard can cause. So it is the chance, high or low, that someone or somebody could be harmed by these and other hazards, together with an indication of how serious the harm could be. So, for example, a hazard could be a wet floor, and the risk is that somebody could slip on that wet floor. And here's another example. So a risk is what can happen as a result of a hazard. So for example, a tray of cups left on the stairs in a care home can cause someone to trip over the tray and fall on the stairs. So question number 5 is asking you to outline what is meant by risk. So think about what we've just talked about on the previous slides and outline what is meant by risk. So on this slide here, it relates to question number 6, and there's 2 links to 2 YouTube clips. There's a childcare example and a health and social care example, looking at hazards and the risks. So you probably would need to copy and paste them into your internet search engine. Watch them both, have a think. Just you can make some notes. You can some of the pointers that you come across within these 2 videos. So this slide again relates to question number 6, and there's some examples of risks and hazards. So the hazard is a soiled nappy in a bin, and the risk, if that bin is left open, young children might put their hand into the bin and develop an infection. Another example, so the hazard is the door to the setting. The risk, if it's left unlocked, children and vulnerable adults may go out alone. The chemical storage cupboard, so the risk, if this is not locked, there is a chance a child or vulnerable adult may access the cupboard. And obviously if it's got chemicals in there, they could get hold of the chemicals. And another hazard, so trailing wires and cables, and the risk, so this is a tripping hazard, so everyone in the setting, it's a risk to everyone. Somebody could trip over it. So question number 6, you need to give 4 examples of hazards in health and social care or children and young people settings, and also their associated risks. So identify the hazard and then write what the risk of each hazard is. Think about the videos that you've watched and also some of the examples on the slides, and I'm sure you can think of some more examples yourself, looking at the risks and hazards and risks. So we've talked about risks, hazards, risks, but now we're going to look at risk assessment and what the purpose of a risk assessment is. So risk assessment is about identifying the risk. So we've identified a few risks in the last question. You've looked at a wet floor, you've looked at an unlocked door, you saw the videos. So we want to know, why we need to identify the risk so that we can potentially, stop anybody getting hurt. So it's important that we do a risk assessment. So assessing the risk, so this is by specifically focusing on the age and abilities of the individual. So if you were in a nursery environment and you were working in the baby room, it's important that you think about the risks, thinking about the age and of the babies. Once babies start crawling, they start investigating, so you need to put safety gates up, making sure that there's no trailing wires where a child could pull and then they could pull something on top of them. So it's important that you focus on the age and ability of those individuals that are going to be in that room, in that setting, or you're going to be working with. You need to identify who may be harmed, and then you also need to identify how you can minimize the risk. Okay. And this slide, it just reiterates really what's just been said. So the purpose of a risk assessment is to identify a risk, assess the risk by, specifically focusing on the age and abilities of the individual, identify who may be harmed, and then identify ways of minimizing the risk. And this leads you to question number 7, and you're going to outline the purpose of a risk assessment. Make sure you use sentences, develop a small paragraph to outline the answer. And a tip here, say what a risk assessment is, then say why it is used. So we're going to look at the slides that relate to question number 8 now. So when is a risk assessment necessary? So I did talk a little bit earlier about in a childcare environment in a baby room. So in this slide, for example, indoor and outdoor environment, using the equipment, on trips out, and food preparation. So it is really important that you think about all areas that you're going to be working, like it says, indoors, outdoors, especially, well, in a nursery, in a childcare environment, children spend a lot of time outside, sometimes as much as they do inside. It's sometimes they have an open door policy where children, as long as there's an adult member of staff with them, they can go out and play inside and outdoors. Trips out, again, in a childcare environment, you may have some trips out to the local park, etc. And also when you're working with adults, you may go out in a car, on the bus, the train, you may walk to the local shops, the park. So it's really important that risk assessments are done. And also with food preparation, risk assessments, so looking at certain what if anybody's got any allergies, if the size of the food that you're serving. Another example of this could be if you're working with young children and you're serving, for example, grapes. Children can, there's been known to choke on a grape, so it's about knowing how you cook grapes safely so that the children can eat them. So a risk assessment should be carried out and checked regularly to make sure that a work setting is safe for everyone. A risk assessment is necessary when a child or adult have different needs, such as they may be a wheelchair user. Another time is when new equipment is brought into the work setting and when new staff join the setting. Another important time is if there have been an accident that has happened in the work setting. So again, if an accident has happened, a risk assessment needs to be done to find out why that accident happened. Accidents do happen, but as long as we can, assess the situation and prevent something happening, if something does happen, then obviously we will look at it again. But hopefully it would be something minor, and you've assessed the situation as best you can. So this brings you to question number 8, which is asking you to identify at least 3 occasions when a risk assessment is necessary. It's an identify, so you need to give a supporting sentences to explain, and at least 3. So you can do more, but not less than 3. And that brings you to the end of this session, and you now should know the main responsibilities of workers and employers for health and safety in health, social care and children and young people settings, and you should have an understanding of the importance of assessing risk in relation to health and safety.